Okay, Professor Meng, everything is working. Go.
Oh,
Go,
thanks.
please.
I'm from Fudan University Shanghai Cancer Center, and my job
Yes.
is focused on the liver and the pancreas cancer. So it's my pleasure to have this opportunity to share our experience with the HIFU in the pancreatic cancer. So we know they have widely used ultrasound in the medical area. So mostly it's the diagnosis, and we also can use the ultrasound to treat cancer, malignant or the benign tumor. So the very successful cases, the fibroid, and in our center we use the HIFU for the pancreas cancers more than 10 years, and why we use the HIFU in the pancreas cancer. And only because the progression for the pancreatic cancer is still very slowly. And the situation for the pancreas cancer, the current, and only 10% of the pancreas cancer can resectable, and even after operation, and the 5-year survival was still very poor. And for the local advanced and metastatic liver cancer, the situation is still very serious. And other problems in the past 10 years, the progression for the pancreas cancer is very slow. So these two tables we can see it's almost similar in the 2012 and 2020. So in the NCCN guideline for the local advanced disease of the pancreas cancer, the first choice, the clinical trial, but not the systemic chemotherapy. That means the chemotherapy is almost doesn't work in the pancreas cancer. So in my center, the equipment we use is guided by the ultrasound. We also have equipment guided by the MRI, but we mostly use the equipment and the ultrasound because it's the more available. And the equipment and the MRI is very complicated because it's also it's not in our department. So this is the whole timelines for the HIFU for the pancreatic cancer in our center, and our center is I think it's the biggest center for the pancreatic cancer. Is more than 2,000 new cases a year. So we have a lot of the choice for the HIFUs for the pancreatic cancer. So we started beginning of the HIFU in the pancreatic cancer around 2008. So this is the initial attempts in around 2008, and because before the 2008, we are very carefully to use the HIFU for the pancreas cancer because we know the pancreas cancer with a very deep organ that very soft, and it's easy to have the risk. So we are carefully to do some cases, very high selected cases. So around 2008, only 39 cases for the local advanced pancreatic cancer treated by the HIFU, 7 in the head of pancreas and 32 in the body and the tail. But we finished the follow-up and we go back to see the data, and it looked like it's very successful and a very good outcome because the median survival time of these 39 cases is almost 1 year, and the complication is very minor. And the very key point is very amazing results. It's the pain relief in this 39 cases, almost 80%. The pain relief is very successful. So this almost the first cases give me a very deep impression because the cases diagnosed the advanced pancreatic cancer and treated by the chemotherapy and concurrent with the radiation. But after the half course of the radiation, the pain and worse and worse. So we do the CT scan, this image. We can see the tumor in the body of the pancreas and involve the vascular. And so we discussed these cases because they failed by the chemo and the radiation. So at that time, we don't have another options. So we try the HIFU for these cases. And why this case gave me very deep impression, because after the HIFU, the day after the HIFU, the night, the patient had very good sleep, and the second day he said, "Thanks, doctor, very much, because it gave me a very good feeling, and my pain is almost gone." So we can 1 month later we do another CT scan. The tumor looks stable, and this situation maintained for 4 months, and the 5 months later the tumor progressed again. So from the 2009 to 2012, so we are to use the HIFU in the almost all the new cases for advanced pancreatic cancer. We have done the 224 cases. So in this stage, we treat not only the local advanced, and we also treat the tumor with metastasis, because I just said in the first 9 cases, the pain relief rate is almost 80%. So we use the HIFU for the stage 3 and the stage 4 with the pain. So in this more than 200 cases, the data shows the median survival of the stage 3 is almost 10 months, and the stage 4 is about 7 months. So I think this with the same equipment for the HIFUs, the procedure is very similar. So we use the prone positions, and the power we use is about 200 to 40 watts, and the whole process of the HIFU is about 1.5 hours. So they have videos we are that's with the videos we are during the HIFU process. And sometimes we use the fusion image to help us to locate the tumor. Let me go fast. So we can see inside the tumor after the HIFU, the color is changing. So, but it's very, very slowly. Okay. So we almost screened the safety data in the 200 cases. So look like safety is not problem, because only few cases have the amyloidosis is increased, and some little GI dysfunctions, and only 1 case have the jaundice. I don't think this jaundice may be caused by the HIFU. Like this case is tumor located the head of the pancreas, and have because the jaundice have a standing inside, and you know, at the beginning we are worried about if the standing inside the tumor maybe cause the reflection of the ultrasound, maybe cause some the desk, the risk of the around the tissues. So in this kind of cases will be down to the power to the 150 and around 200 watts. So this is the pre-HIFU, the 3 months after HIFU, and the 6 months after HIFU. So we can see the tumors are stable. And this case is the located the body of the pancreas. So this is the pre-HIFU, so 1 month, 3 months, 4 months, 8 months, 50 months, and this case is just use the 1 time HIFU. It's maintained almost 2 years, no chemo, no radiation, and this progression after 2 years. So that's you know, just one time HIFU. It's very, very successful. And like this, also in the body of the pancreas, pre-HIFU, 2 months and 8 months, we can see the tumor volume is shrink. And in this case is do the PET-CT scan before and after the HIFUs. And before the HIFU, we can see the FDG the value intake in the T of the pancreas after HIFU and FDG almost disappeared. So in the 2016, we published another data. So we analyzed the more than 600 cases of the advanced pancreas cancer, and in this analysis, so the survival situation is almost similar with the from 2013 to 2016, but in this data we have another findings because it's called repeated HIFU and one-time HIFUs. The survival time is different. So because in the first 5 years, almost all the cases we just use the one-time HIFUs because our medical insurance problems. But in this, after this data, 2016, we found that the cases repeat HIFUs is have the advantages of the one-time HIFUs. So because the HIFUs will not cure the cancer. So this the safety analysis of the single HIFUs and the multiple HIFUs is look like it's very similar. It's no problem for the multiple HIFUs. It's a safety. And in 2019, we published another papers to combine with the HIFU combination with the gemcitabine-based chemotherapies and versus the gemcitabine-based chemotherapy alone. And so very obviously, the combined HIFUs, this group of patients have the survival advantages because we have prolonged the survival time for more than 1.5 months. So I think this in the past about 15 years, so the HIFU is very popular in our center to use for the pancreas cancer. But I think there's some disadvantages of the HIFUs, and you know, the pancreas cancer is in a very deep position of abdomen. So sometimes we cannot see very clear in the ultrasound, and the HIFU we use the low power. And the treatment was during long time, 1.5 hour, 2 hours, and for some very sick cases, they cannot insist on so long time. But this I compare with the other local regional therapies, ablation, HIFUs, RFA, and RE. And the HIFU, I think, the advantage is low risk, non-invasive. It can repeatable and low cost. But for the RFA ablation, I have tried a few cases, but finally I gave up because it's very dangerous and it's more risk. And the RE, it's very popular in the recent years because have the normal tissue protection. I have tried about 15 cases. I think it's not easy because it's need very skillful, and the cost is so much. So I think the HIFU in the current situation have a lot of advantages for the pancreas cancer. But most of the field by the pancreas cancer treatments, it's the metastasis. So I think the local regional therapy is not the future for the pancreas cancer, but in the current situation, the progression of the pancreas cancer is very slow. I think in the future 10 years, maybe 15 years, HIFU still have a very good advantages for pancreas cancer. So that's my experience. Thanks very much.